Hi, I am Dr. Jessica Meers. I am a sleep psychologist, and in this video, I want to take some of the mystery out of CBT-I by walking you through what therapy actually looks like. So if you've been curious but kind of unsure what to expect, this video is for you. CBT-I is a short-term and fairly structured treatment. So most people complete treatment in about 6 to 8 sessions. And each session is usually happening about once a week, although sometimes we will taper down to every other week as you make progress. Unlike open-ended therapy, CBT-I has a fairly clear beginning, middle, and end. It's a step-by-step process that helps you to retrain your sleep system. Now, of course, that doesn't mean that we can't be flexible and integrate some treatments for anxiety or depression or something else that comes up. But if it's fairly straightforward insomnia, then it is a pretty straightforward treatment. The first session is all about getting to know you and your sleep. So we'll talk through your history, how long you've been struggling with insomnia, what you've already tried, and how insomnia is impacting your life. We'll also talk about any medical problems you have or psychiatric history that you have. You'll also learn how to use what we call a sleep diary, which helps us to track the patterns in your sleep between sessions. It's not about recording sleep perfectly, but it does help to give us a really clear picture of what's happening. And each week, we'll use information from that sleep diary to guide some changes. So for example, we'll work on adjusting your sleep schedule to reset your body's clock. We'll also work on building a stronger link or association between the bed and sleep. And you'll learn how to handle those racing thoughts that might pop up at night. We'll also create a wind down routine that signals to your brain that it's time for rest. This is in all a very collaborative process. You and I would work together to test strategies, to make adjustments, and then find what works for you and your body. Many people notice that their sleep starts to feel different within the first couple of weeks. Sometimes you actually might be spending less time in bed at the beginning, which sounds counterintuitive, but it helps to build a stronger sleep drive and eventually get deeper sleep as time goes on. Over time, as your brain relearns that the bed is for sleep and not wakefulness, you'll be able to expand your sleep window naturally and start to feel more refreshed during the day. So that's what you can expect with CBT-I. It's a fairly short-term, step-by-step process designed to help you retrain your sleep. In the next video, I'll share the science between why these strategies work so well. And if you're ready to see if CBT-I is a good fit for you, you can book an appointment on our website.